Well, in this study, we have investigated one of the largest cohorts of women with MS with long-term follow-up, clinically and radiological follow-up. And we wanted to see whether anti-müllerian hormone that was examined at the time of the first attack was able to predict what was happening in the long term. Anti-müllerian hormone is important because it is a marker of our ovarian reserve. And one of the first things that I would like to highlight is that we didn't find differences between the levels of anti-müllerian hormone in our patients compared to healthy controls. So this is an important message for our patients. The fertility doesn't seem to be reduced. Second important finding was that the anti-müllerian hormone levels were not associated with the degree of inflammatory disease activity when we were comparing these hormone levels to number of lesions, gadolinium enhancing lesions. So in a, let's say, correlation, we didn't find this correlation. And the third important result is that when we are seeing whether these anti-müllerian hormonal levels are associated or were able to predict the long-term prognosis, we couldn't find we couldn't find that the hormone levels are predicting the long-term disability once we take into account the chronological age. So these findings suggest that ovarian aging is a biomarker of biological aging, but is not the direct driver of our prognosis. That probably is more chronological age that is marking or that has an impact in our prognosis more than the ovarian reserve. And I think this is very good news for our patients.